I hope you are doing well with your fur babies and you are having a lovely day. So as you know, I'm very passionate about continue finding very interesting and amazing guest speakers to our show who always love their fur babies, also have very interesting professions, and they're willing to be with us to share more about their knowledge and what they do. So today, our guest, she's very talented. She has a kitty cat. I actually was very fortunate to photograph her fur babies. And then when she told me, oh, Vasi, I'm a plastic surgeon, I said, you know what? I would like personally to know more, because I always believe that, we just have to kind of keep, broadening our horizon. So today I'm very excited to welcome to our community and to introduce you to Dr. Allyson. And again, she's a doctor, she's fantastic, but to me, she's Allyson. So thank you very much. And, I'm very excited, very impressed by your profession and passion for babies as well. So can you tell a little more? Let's start first with your kitties. I had the opportunity to photograph, here, friends, you can see some pictures of your fur babies.
Oh, they turned out amazing. Yes, that's Winston and Tyson, my furless babies, I guess. They're my sphinxes. They're 13. And oh, you did such a good job. The pictures turned out amazing.
Oh, thank you. Thank you. Yeah, it was great. I had so much fun of taking pictures. And friend, that was one of, honestly, the fastest session I ever had in my career.
Was it real? Well, you got the images so I was just surprised how well they cooperated and how you made them work. And the pictures turned out so good. I love them.
Yes, I love them too. Thank you so much. And you just got yesterday your canvases,
yes,
which came out really
I
very
love.
Oh my God, they look like real. They really when you look at the canvas, you're like, oh my gosh, they're going, to start talking to us.
I know. Oh, they're such little gentlemen, their little bow ties and sweaters. Oh, I love it.
They're adorable for sure. So, plastic surgeon, this is a very, of course, for me, everything, it's with all of the respect, it's complicated because it's like humans, and I ask you that you said that you do different things. But can you tell us, how did you decide to get into this field?
Yeah, so I always knew I wanted to go into medicine. My dad's an anesthesiologist, and so I actually thought that's what I wanted to do. And so I went to med school, and in med school, you do different rotations of the different specialties. And I did anesthesia, and it wasn't quite what I was hoping it would be. And so, and I really like surgery, which, I didn't think that I would like surgery or be attracted to that lifestyle. But knowing myself, if I'm around people that are dying and sick, it tends to make me sad. And so plastic surgery is, one of the surgical subspecialties where you just get to make happy people happier is how I look at it. And so it's just a very positive thing, even if it's not cosmetic, the reconstruction after trauma, after breast cancer, it's still, it's happy for the patient because they're getting to feel whole again.
Yeah. And I would also say, make people feel beautiful, because again, we know that the inside beauty is important, but outside beauty as well, it's important. And just exactly, you are not only doing your art but you are also building people confidence and to believe to themselves, because that's how I also see it.
Yeah, absolutely. And that's one of the best parts of my job. Something that bothers somebody makes them not as confident. And then you just do a little tweak and, they're living their best life. And so it's great.
Oh, for sure. It's definitely great. And so I also know that you have your own practice. And by the way, I'm just going now to, to show your, website here. I'm really in love with your website. And thank you so much again to everyone who is watching us live or you're listening this as a podcast, friends. I love the name. Obviously, we are very lucky to be living in sunny Florida.
Yes, absolutely. The palm. Yeah, I just started my practice a couple of months ago, and it's been great. I didn't have much business experience, but I was able to kind of figure the different little nuances out. And so now I'm getting to just operate and do what I love and see patients in my clinic. And it's been wonderful. I'm really happy.
Well, I'm very excited for you because I definitely think that, people, need you. So it doesn't matter where do you live. I really believe that people do need you. And so I would kind of approach it because some people might be a little skeptical and may ask the question, okay, so why do I need to do a plastic surgery? What would you tell them? Why should they do? And especially since a lot of times they're medical, as you said, people overcoming serious illnesses. So from your point of view, what do you tell your patients?
So when it's patients that, that are coming, they don't have trauma or something that needs to be reconstructed, it's more just for cosmetic type evaluation. I always start off by telling them there's nothing that they need to do. If you want to age gracefully and not do anything, that is perfectly fine. But if you want to, do a little bit of enhancement, just kind of ease the aging process, if that's going to make you feel better, then I think you should do it. Whatever gives you the most self-confidence is what I tell people they should do. And, it's on a spectrum. Some people, want to look like they haven't aged at all. And some want to age, but just, a little bit more gracefully. And so there are things that we can do ranging from non-invasive, non-surgical up to surgery. And so with the spectrum of things, there's always something when someone comes to see me that we're able to do.
Yeah, it's very interesting because you and I were kind of do similar. So with my photography, when I do business portraits, my sister would say, oh, I can, especially in the beginning of my career, she would say, I see this picture here. I know the person, you kind of did a little more smoothing on the skin. And I would tell her, so this is not my choice, in a way that people tell you how much they would like for you to edit their pictures. One of the reasons why I actually went with pet photography as well, it's because no one would tell you, oh, listen, smooth the skin here. I don't like the smile, like on my child. And they would say, I love my fur babies. I love my kitty or a doggy. But, it's like people need to understand that we as individuals have our choice. And just
absolutely.
Right, we do have it. And it's just really a good communication with your plastic surgeon to help you and guide you what is the best solution for what you need.
Yeah, absolutely. Depending what you're looking for, it could be a non-surgical option, just doing different creams, sunblock type things, lasers, all the way up to surgery. And so exactly, it's just whatever the specific person is looking for. And that can look different for, everybody.
Yes, I'm sure. And I'm guessing, and that's my guess, because again, I don't really know much about your profession. That's why I'm excited you're on the podcast.
Well, thank you for having me.
Oh, of course. Listen, friends, when, Allyson said, yes, Vasi, I will come. I'm like, this is incredible. So I talked to Mary Ellen. So Mary Ellen, it's my bestie in crime. She's a pet clothing designer. So she volunteers her time. She does the magazine with me and etc. She said, Vasi, this will be a very interesting episode. I'm like, of course it's going to be. Are you kidding me? I want to know. And especially now with, I would say, summer, being right there on the corner for most of the part of the world. And so the sun has been, very strong and etc. I'm sure that, there are some precautions people can take, or are there any tips you can give people, especially now for spring and summer seasons?
Absolutely. So two of the very best things that you can do to prevent aging or, slowing the signs of aging is always using a sunblock, especially in Florida. It has to be at least an SPF 30 and wear it religiously, reapply it. Even driving in the car with your windows up, you still can get sun coming in from the driver's side. So doing that. And then you can also use a cream like a retinol type cream, like Retin A. They have different brands, different percentages of the actual active ingredient. And initially it can cause some redness, irritation, but it actually helps turn over the top layers of skin. And so it can get rid of the little pigmentation that you may have from being out in the sun. And so it really helps with aging spots, things like that. So that tackles that. And then the sunblock prevents it. So those would be my two recommendations for everybody.
No, that's actually, thank you so much. This is very helpful. I do agree with you, sunscreen. And I just want to remind people, and again, I'm not a vet, nothing, but they do have also some cream for pets' noses as well. I have seen they have sunscreen for pets. And again, I cannot tell you ingredients, friends. I'm the photographer. I'm the picture lady here, and not my, expertise, but yeah, we need to take care for us, and we need to take care for, for our four legs loved ones. And then just curiosity. So of course it will depend on age and etc. But like the skin, can I just ask you about, are there any major difference between men and women, the procedure they can do?
So there are differences. Depending what specific procedure, like there are just known things like for men in facelifts, they have a little bit higher rate of complications. Could be they're a little bit, not quite as compliant as women, or just, blood pressure tends to run higher. So just different things that you need to be more aggressive with, keeping blood pressure under control. The actual procedures themselves, they're for the most part, they're the same. There are some procedures that men only that we do. Sometimes if men have enlargement of their breasts, it's called gynecomastia surgery, where we flatten it out. Obviously, for women, when we approach breast surgery, there's typically a different goal in mind. We want to enhance things like that. So it really just depends on the specific procedure. But male plastic surgery has actually increased a lot, specifically over the last couple of years. And so we're seeing more and more men that also want to take care of their skin, and they're starting with, Botox, things like that. So
it's amazing, to be honest with you. I really love the fact that overall, the modern people right now are just really being more cautious to take care of their health and, and their look. And I can even tell you, I was joking with my mom, since officially I turned 40 recently. And so, and then my mom is telling me, so listen, Vasi, there are some people in our country, in Bulgaria, and they're your age, but they do look older. And I'm like, well, mom, it's a combination of taking care of yourself. And to me, the new 40s are the new 20s, because just we are more educated. We have people like you, who can help us to continue visually look better.
Absolutely.
It's important. And I like the fact that you have a choice. Okay, is it going to be injectable? Is it going to be, surgical? And it's, since this is very common all around the world, and again, it's a personal choice, but I'm kind of, I'm glad we can talk openly about it, because it's a lot of times, and I can even tell, some people will tell me, oh, you do this, well, make sure you, and I'm sorry, as a woman, I would talk about me specifically. My sister would say, look at Vasi, you have few extra wrinkles here. Take care of it. Come on, Vasi. So, well, wrinkles, there will be, there will happen. So the question is, how do you want to approach it? And then here you come in place to give the recommendation of what will be the best approach.
Yeah, absolutely. And that's what I also like about plastic surgery, is there's so many different, like a spectrum of treatments. And so somebody that's, doesn't want surgery, but maybe wants to help with the aging process, you have the things like the injectables, the Botox or the fillers, and you can do lasers to help with skin. And so there's so many things you can do besides just having surgery done. And I think the younger generations, it seems to be starting earlier and earlier that they're taking care of themselves. They're, being cognizant of wearing sunblock and things like that. And so I think, they're going to look younger for a longer period of time, which is great.
Oh, for sure. It is great. Okay. I do have a silly question, and I apologize. I know a lot of people will be laughing at me.
No silly questions.
Thank you. So what is the difference between a Botox and a filler? Just basic, please, like for a person like me who has no clue.
Yeah. So filler, you're injecting something under the skin, like a jello type consistency. They obviously range, and some can be firmer, some are not. So you're adding volume wherever you inject the filler. So if there are creases, things like that, you're plumping them back out by putting the filler in. Botox works directly on the muscle. And so it causes the muscle to not activate. And so whenever, you move and you raise your eyebrows, you see wrinkles in the forehead, that's from the muscle activating. And so Botox stops it from activating. And it can last, 3 to 6 months for most people. everyone's body is a little bit different of how they metabolize it. So filler, you're just adding volume different places. Botox, you're telling the muscle, don't contract, so I don't get those wrinkles.
This is very interesting. Well, thank you so much. Now, at least I feel like I have more clarity, because I'm like, okay, what's the difference here? I have no clue. So now I do have. And then would you maybe suggest for people to use both, depending on the part of the body or the end result they would like to have?
Yeah, absolutely. And a lot of people do both. Botox, works in certain areas a lot better. Like the forehead, it does great to get rid of those little crow's feet when you smile. It does great, and to get rid of those 11 lines. And as you go down on the face, there's certain things you can use it for as well, but typically fillers on the lower part of the face. So how we get these deep grooves here, you can inject with filler, things like that. And filler can also be used to help you have very slight, but people that, when are resting, not moving their face, when they have the deep creases, filler can be really helpful for that.
Okay. Wow. Wonderful. That makes a lot of sense. And I do have a last question, and you probably will ask me, Lassie, why are you asking this question? So I think that neck, and I'm sorry, but by the way, I was very impressed. Okay, I guess two things. I was very impressed when you and we worked with the pictures of your kiddies, that they are a solution for hands, because this one thing I have noticed as a photographer. I do have photography tip. I tell people, bring your hands up so the book and everything can go down. And then for the picture, you bring them down. So at least for a few seconds or a minute, your hands would look better. But I know that there are solutions. So my question is maybe to give some recommendation, just tell people the option. And the second question is about the neck, because it's like, well, I guess, friends, I'm very honest, transparent. So I'm like, okay, exercises here, look at my neck, So I know that everyone probably is asking you those as one of the most common questions. So yes, please, what do you think?
Yeah, absolutely. So for the first question with the hands, it depends kind of what the exact issue is. Some people get like a lot of sunspots, things like that on their hands. You can do lasers, you can do different creams for the complexion of the skin. You can get hollowing, which, I kind of have, my mom has it, and where you can like really see your tendons, things like that. And for that, you can do either a dilute filler that you can inject, and it just kind of smooths everything out. Or you can even take fat from your own body and inject it into the back of your hands, and it just creates a smoother appearance. Yeah, it's amazing. Especially people, I've always had kind of, skeleton-like hands on the back. My mom does too. It just runs in the family. And so for things like that, now there are options.
Oh my gosh, this is absolutely incredible. Yeah, now I know. I'm sure, friends, and again, I would definitely encourage you, to make sure you connect with Dr. Allyson. Again, information, everything is below. But yeah, so that was the next.
And then, for the neck. So the neck, that's one of the most common things people come to see me about. And again, it just depends on what the specific problem is. So, younger people, you can see banding. And so you see like bands in the front and things like that you can treat with Botox, and it can just soften them. If you have fullness under the chin, which kind of contributes to the aging appearance of the neck, you can do different things. You can either suck out the fat with liposuction, or there's even something called Kybella, which you inject it and it causes the fat cells to rupture basically. And so it kind of smooths it out. It sounds great because you don't have to have a surgery, but it often takes multiple treatments and you're really swollen afterwards. For aging, when we age, everything kind of descends down. And so that includes the neck, and you get extra tissue and extra fat there. And so the best thing to address that is a facelift. Facelift addresses the bottom of the face and the neck, which most people don't realize. So if you have, the bottom of your face, you have jowling, which is kind of like fullness in this area, plus aging in the neck, a facelift's a great option. If you just have aging signs of the neck, you can do just a neck procedure where you make an incision and you can tighten the muscle there and get rid of some of the excess skin. So just, again, it depends on what your problem is and what, is most bothersome to you.
No, this is I think it's like, I cannot thank you enough, truly, for coming today with us on the show and giving us so much value and giving us because I'm sure that a lot of our viewers or listeners have been asked themselves the question, and going to read online, there are so many, like, it's like, how to get a good photographer? What type of portraits do I need? Well, it depends on a lot of things, including on you. And so the same it's with, all the procedures and approaches you are, share with us. And you told us that there is an option, but I cannot thank you enough, because you cover everything. You cover the forehead, the face, the neck, the hands, and you told us what it's a pure Botox, the different options and more common things. And can you tell people where they can find you on social media?
Yeah, absolutely. So my social media name is allydezielmd. And then for my practice, it's palm plastic surgery. My office is located off Military Trail, and I do complimentary consultations for cosmetic patients. And so I always tell people, if you have questions, or, you're not, you don't want to have surgery now, but you just want to know what your options are, I'm always happy to see you in my clinic and, discuss what your concerns are and things that could address them.
No, this is great. And I just want to tell you, friends, so this is located in Palm Beach Gardens, South Florida. So as I know, we have a lot of friends and followers from all around US. Well, maybe you should consider coming on vacation to meet us in person and meet Dr. Allyson as well, and take advantage of her amazing service. Also, I would encourage you can take a screenshot of this, use a second device, and you can reach to her with the QR code, take a picture. And I made sure that I added all of her information as well below in the description. It doesn't matter if you're watching this as a podcast, watching it or listening it. And I know you have a patient coming in a few minutes. So, I cannot thank you enough that you found the time to fit us in your busy schedule, because I know that, your patient need you. I think people need you. And I would just finish it as this. So you see, friends, all of us, we are connected by the love of our fur babies. And I think this is absolutely incredible. And what is really very empowering, that each of us, we do have our career. And sometimes what the society would say, oh, plastic surgery, or maybe injectable. Why? That's not a good thing. For example, people would say, that's not a good thing for you, Vasi. But do you know what? The beauty of life is that we can make our own decision, and having the right people like Dr. Allyson to really give us a recommendation, because as you heard, she offers, free consultation, which honestly, it's very valuable to me, even itself, really kind of help us to make decision. What do we do? How we are going to age, or how we are going to enhance our look. So thank you again, sincerely. And I know that you'll be back in the show. Hopefully, I know you'll be busy. You're busy, but in the future, friends, Dr. Allyson will be so generous to write an article for our magazine. So stay tuned. It's not going to be our next issue, but it's going to be in our upcoming issue. But just this is the first time for many more to come. So enjoy your day. Have a great day with your patients. Thank you, friends, for watching and listening. And just know that beauty, it's inside and outside. And just we share it with our fur babies, and life is beautiful. Thank you very much. See you soon. Thank you so much. Bye-bye.